How to handle isolation after radioactive iodine for thyroid. After receiving radioactive iodine therapy, or RI, for thyroid disorders, especially hyperthyroidism or thyroid cancer, there are important steps to follow regarding isolation. This is crucial to protect others from radiation exposure. The length and strictness of isolation can vary based on the dose of radioactive iodine given and your specific medical situation. First, let's talk about the duration of isolation. Typically, you will need to isolate for at least 3 days. However, this can extend up to 2 weeks depending on how much radioactive iodine you received and the reason for your treatment. Those treated for thyroid cancer often requiring a longer isolation period than those treated for hyperthyroidism. Your healthcare team will provide specific instructions based on your treatment. Now, why is isolation necessary? Radioactive iodine emits radiation that can linger in your bodily fluids, like saliva, sweat, and urine, for several days after your treatment. This is why isolation helps reduce radiation exposure to family, friends, and especially vulnerable groups such as pregnant women and children. When it comes to isolation practices, staying in a single room is recommended if you are hospitalized. If you are at home, try to maintain distance from others, ideally using a separate bathroom if possible. Avoid close contact, such as hugging or kissing, and do not share utensils or towels. It is crucial that pregnant women and children do not enter your living space during this time. Good hygiene is also essential. Wash your hands frequently, flush the toilet twice after use, and clean surfaces regularly. Managing radiation in your bodily fluids is another important aspect. Drinking plenty of fluids can help flush the radioactive iodine from your body more quickly. Avoid actions like spitting or drooling to minimize contamination risk. Using disposable tissues and discarding them safely is also a good practice. You might experience mild throat soreness or a dry mouth during isolation. To help with this, sucking on sugar-free candy or chewing gum can provide relief. If you have mild pain, over-the-counter pain relievers can be used, but always consult your healthcare provider first. Isolation can feel lonely, so it's a good idea to arrange for social support through phone or video calls. Preparing your living space and supplies in advance can help reduce the need to leave isolation. Finally, regarding follow-up and the end of isolation, radiation levels will decrease over time. Your healthcare provider will determine when it is safe for you to end isolation based on radiation measurements and safety guidelines. Most patients can expect to be released from isolation within a few days to 2 weeks, depending on their specific treatment. In summary, handling isolation after radioactive iodine therapy involves closely following your healthcare provider's instructions, maintaining physical distance from others, practicing good hygiene, managing any symptoms, and ensuring emotional support during this period. These measures are vital to protect others while your body clears the radioactive iodine safely.